Hello everyone. Today in this video I am planning to discuss some points on hearing assessment in children and its significance. As my next video will be a follow-up of this video, which will be focusing on how to rehabilitate a child with hearing loss. So what is generally employed for a hearing screening in newborn? In newborn, there is a handheld machine OAE, that is it picks up the autoacoustic emissions from the outer hair cells. It is a part of the inner ear. So if that is present in both the ears, then the child is tagged as pass. The child doesn't need further evaluation if the child doesn't fall in the high risk category. And if the child fails in this test, that doesn't always mean that the child is hard of hearing. He or she has a hearing loss. Then the child undergoes an automated brainstem response test. So if the child fails in that test also, then we have to look into the further rehabilitation of the child. So if the child passes in this ABR test, the second test, and but fails in the first test, that means the child will have to be followed up once in 8 months or 6 months for reassessment of the hearing. So, who are the kids who are high risk, who fall in the high risk category, who undergo both these tests together? They are the ones who have a history of an ICU stay, the ones who are born with low birth weight, who have history of hyperbilirubinemia, the ones who have received ototoxic medications, those who have undergone mechanical ventilation, or those who have stayed in NIC for more than 48 hours. And the other ones include who have strong family history of early childhood hearing loss, and the others include those with syndrome, mainly example like Down syndrome, uh, are the ones who are at high risk for hearing loss. And if your child has passed both these hearing tests, so that doesn't mean that you should ignore, you should not be continuously following your child for any hearing issues. If your child has already passed the hearing screening test, but gradually you notice that the child doesn't actually turn to noise or sound, and you feel that the child is not attentive to your speeches or to your talks, that means you should get the hearing evaluation done, because the child might be having a very common entity known as otitis media with effusion, that is OME. The risk factors include passive smoking, bottle feeding, a sibling who already has an OME, or if the child is in a daycare unit. The other leading cause for acquired hearing loss is following meningitis. Meningitis can also cause permanent hearing damage in children. So the main intention behind making this video is to educate the parents that just because a child has cleared a newborn hearing screening, that doesn't mean the child will not land up with hearing loss or does not have a hearing loss. That there are so many entities that show at a later stage which are not picked up at birth. So it is imperative, it's very important that whenever you communicate with the child, make sure that the child listens, make sure the child follows it. Don't unnecessarily scold the child. The child is not following what you're saying. The child might be hard of hearing, which you are not aware of. So with this video, my only intention was to create a small awareness about the hearing loss, which can be picked up later in a childhood, which is not always picked up in infancy. In my next video, I'll be elaborating the points how we rehabilitate a child who is hard of hearing. Thank you for watching.